Jackie, we did your acne scarring treatment with laser and Taylor Liberator subcision. Now, your subcision was about 26 days ago, which is about 3.5 weeks. And you had tethered scars and boxcar scars. The laser we did first because we wanted to sort of smooth down those boxcar scars. And then we did the Taylor Liberator to release the tethered scars. And you are now 3.5 weeks. How have you found the Taylor Liberator so far?
Yeah, it's not that bad. Honestly.
It's scary when you see it, yeah.
Yeah, when you see yourself at first, it's a bit of a shock.
Okay. But once tell me about the recovery.
Yeah, the recovery was not as bad as you think. It was actually quite smooth. Majority of the swelling went down by 24 hours for me, personally. By 48 hours, I was back at work and nobody even knew I had anything done. So it was pretty smooth recovery.
Well, the odd small blood clot, little lump, bruise, anything? You were okay? You were lucky because some people get little blood clots and a little bit more swelling. That's fine. But you said you were back at work how many hours later?
48 hours later.
48 hours later, okay. And any sort of compromise from a work point of view?
No, not at all. I mean, I came into work and I was like, guys, my cheeks are a little swollen. They're like, we wouldn't have noticed if you didn't say anything.
So you even told them your cheeks were swollen,
did,
and they were like, well, we wouldn't have noticed if you didn't say anything, okay?
And then when I showed them pictures, they were surprised that my cheeks went from what they did to that in 2 days. The
thing that lots of people don't understand is because we use tumescent anesthesia in Taylor Liberator and we actually use adrenaline in our anesthetic mix, you don't bleed that much. The cheeks look a bit hamster-like on the first day, but actually compared to any other method of subcision, your recovery is quick because of minimal bleeding. So that's why you were able to get to work really quickly afterwards. Yeah. Now, as you know, there are a lot of these internet trolls right now trying to destroy Taylor Liberator subcision as a procedure under the pretense that they have deformities in their face, say namely like chubby cheek syndrome. Now, you have had the Taylor Liberator procedure and you have had your scars released right now. Can you do a little sort of side-to-side turnaround? Now you have a absolutely perfect jawline there, and your cheeks don't look like they're sagging at all. I mean, have you been upset in any way with your face shape afterwards?
No, not at all.
Not at all?
No, not at all.
When you sort of look at yourself in the mirror, what kind of change do you notice after the Liberator?
Oh, that my skin's a lot smoother in texture, and I can actually, when I put my makeup on and I go under certain lights, I don't have to worry about the heavy rolling scarring that I used to have. So
that rolling tethered indentation. So you see that's released up pretty quickly, hasn't it? Yeah. And you see, once you have a procedure that is a proper subcision, not a subcision done with a blunt cannula that doesn't cut anything, and they put fillers under those blunt cannula subcisions to try and release scarring, but that's not doing anything. What they're trying to do is just trying to lift up some scarring because the cannula is not really subcising it. Here, we didn't put any filler in your cheeks, did we?
No.
Obviously, that would make your cheeks more puffy anyway if we did. So the funny thing is, everywhere around acne scar treatment, people are putting in volumizing filler under the cheeks, and a procedure which doesn't involve putting filler in is being criticized for creating sag cheek. It's a little bit paradoxical, really. So you're quite happy that you had it done?
I am.
Would you say that, given what you've done before to treat your scarring, how effective has this been?
Extremely.
Extremely.
Yeah, I have spent a lot of money on different types of scar treatments that didn't really do anything. So this is the one thing that I think was very, in combination with the laser for me, very beneficial. I mean, I see a difference. I actually wear makeup a lot less now, which is really nice because that's something I've always wanted to do. Yeah. And when I do wear my makeup, I can do things like contour and highlight that I was never able to do because it brought the scars out. Right. So for the first time, I actually don't have to do that. And even my husband says that, like, I see a totally different confidence in you now than I did prior, comparing.
And that's what acne scarring management is about. It's not about a quick fix. It's about a permanent fix. Once the acne is solved, and helping people to restore their facial anatomy to what it was before. If I think when you came to me, you said it bothered you usually around about 8 or 9 out of 10. Now, on a day-to-day basis, how much out of 10 are you bothered by it?
Not at all.
Not at all?
Yeah, I wouldn't say. I'd say from what it used to be, not at all. Like I said, the fact that I can actually not wear makeup is a huge thing for me.
Right.
So I would say I'm a lot more confident now than I used to be.
Fine. You see, I think the thing with this type of procedure, we did it in like a single round. When I say single round, I mean we did the laser and the tail liberator in one cycle as part of the flow chart. What kind of percentage improvement have you experienced so far?
Oh my God, I would say, for me, looking at it, I would say probably about 95%.
95? I mean, you can be conservative if you want. I mean,
No,
but
I would
I'm
say
expecting to
95.
get around about 70%.
Yeah.
But if you've got much more, then that is excellent. And that's just from one round of treatment with the surgical subcision as well as the full ablation laser. So prior to this, how much, I mean, can you put a ballpark number on how much you spent with many treatments and how many years?
Oh my God, thousands and thousands. And it's, you know, a lot of these other treatments that you do, you might see a slight improvement for a period of time, but then it's like everything just reverts back and you really don't see a difference. So having something like this done where it is, it's hard. You have to be mentally prepared to do these types of things before you get into it. So I think for me, I was so, one of those things where that's saying like, you're so sick and tired of being sick and tired, you'll do whatever, you know?
Yeah.
So I was at that point. So when I did these treatments, I was mentally prepared to, it's not going to be easy, but my God, was it worth it? Because I would rather spend the chunk of money that I have doing this and get these types of results than spending even what really would amount to even more over a longer period of time, if that kind of makes sense.
Yeah, because it's a bit of a hard cycle in one go. But once it's done, and your acne was all obviously treated before the Accutane, so you didn't have any more active acne, then it's done. And you don't have to worry about things anymore. And you can get on with your life.
Yeah.
What would you say to these people who have been sort of trolling us and saying, stop tailor liberator subcision because it causes fat face?
I don't think...
And saggy cheeks.
Yeah, I don't think it's necessary. I mean, everybody is going to be different. Everybody's journeys are different, but I don't think it's quite fair to put it out for everybody because it's... I don't think it's fair because like if I were somebody reading the comments and that, which I'm sure that there are actually many people at the moment reading those comments and second guessing their decision, and that decision is so crucial because that could be like me, you know, it was such a positive experience for me and I haven't had any complications. I've had a really smooth transition and I'm so glad that I did that. That could be putting somebody else off to making that decision to where it could be life-changing. And, you know, and you cannot put a price on confidence on somebody's to be able to do things like not wearing makeup, or when you do wear makeup, you can play with it a little bit more because you don't have to worry about the way that your skin looks. And I just think that people need to be a bit kinder, and I think they need to be careful of their words because those words can influence somebody's decision that could change it for the better.
We had an example of that last week. We had a patient who was calling us after all these hateful comments about subcision. You know, a procedure that has been around for 15 years now, that has been a pillar of acne scar care and improvement. And they were actually very scared to go ahead with the procedure. They were saying, Dr. H, I'm seeing all these comments. I'm going to be a young lady like yourself who worried about my face becoming saggy and permanently destroyed by the procedure. And I said, look, why don't we speak to patients who have had this procedure done? She had it done once she'd spoken and essentially came back to me and said, I can't believe I was about to stop doing this because of this scaremongering, because it's really changing my appearance and changed it for the better. So the problem here is this small group of people that has appeared just post-September 2022 in a procedure that has been around for 15 years and essentially are not happy with their original face shape and are constantly trying to look for surgical and cosmetic methods to improve their face shape, are blaming a tried and tested evidence-based procedure. And not only that, the criminal thing is they're putting people off something, like you've just said, that can be life-changing for them. What's your thought on that?
No, it's like I think it's unfair. As somebody who it has impacted very positively in my life, I mean, me personally, I think everybody deserves to feel the way that I feel, and we're very fortunate to have somebody like you that knows what they're doing and can provide that for people. So I think it is unfair with a lot of people online saying these things that can divert somebody to not feeling the way that I feel.
Yeah.
And I don't think it's fair.
I mean, from trying to find this originally, it's not easy to find a service that does this. How easy was it for you to come across our surgical acne scar management pathway?
I was very fortunate. It was luckily because to Google I typed in, what I thought was my type of scarring, and your name was the first one that came up. So I was very lucky in that sense. But it's not it is a well-known type of procedure, but not everybody does it like you do.
You'll see in the UK, in terms of full ablation and tailor liberated subcision and treating acne scarring with surgical methods, there isn't any other center like us. Were you able to find a comparative center that could do it?
No.
Where, and if there was probably going to be in the US or in a different country.
Yeah.
Which is a damn hard trek to get to.
Yeah.
We have a lot of international patients that come and see us for this kind of problem, because there are probably about 3 or 4 centers worldwide that do this kind of mix of treatments. So the upshot of this, in my opinion, is that basically these people who are trying to get their own agenda of money for facelifts to try and improve their face in general are basically destroying a much needed service in the UK. What would you say to that?
Yeah, I mean, I would say, like I said, a lot of the comments are very unfair, and I think that they really need to think about things before they're said, because again, it is one of those things that is deterring somebody who really needs it. Because as somebody who's lived with this type of scarring, it's hard, and you will do anything that you possibly can to feel that confidence, because it's your face. You can't hide it, like the rest of your body. So that is, something that, and not to mention, there are a lot of people that have my type of scarring, a lot of people, whether it might be a small patch, it might be half of their cheek, it might be on both cheeks, but as somebody who lives with that, I know what those people go through every day, and I think that they deserve to at least have the option to do it.
Yeah, we don't coerce anyone to do it. We informed you of all the risks that could occur. You're now aware, because you had this done recently, about this fat face issue. So, you went into this wholeheartedly evaluating the procedure. What would you say now? It's been a positive experience for you?
It was a positive experience. And I mean, I did see some of the comments before I done the procedure, but I made an informed decision myself. That's something that everybody has to do. Do your own research. Be confident with your decision, because you should never go into any procedure with anxiety or you're unsure. Go in wholeheartedly ready to do it, because I think that you need to be mentally prepared for any type of procedure that you do, because that will greatly affect your outcome.
In a surgical procedure like this, there are always risks, and risks can be bleeding, blood clots, nerve damage. There can be swelling. Swelling can be prolonged, but swelling does not last forever. Swelling usually will last for up to 3 months, depending on how extensive the subcision was. So essentially, you're going to get risks with any surgical procedure. I didn't anticipate that the small subset of people would jump onto this fat face sort of issue, and it hasn't been the case for 15 years in my colleagues' experience that anyone has. So I don't think that destroying a valid procedure is the way forward. However, people should be able to make their decision, and I completely am fine. If people don't want to go ahead with surgical subcision, that is okay. But misinforming people with false medical information and calling and informing other patients to try and avoid the procedure on social media is going to stop them from getting the degree of benefit that you get. And that's what really upsets me. So, I mean, people should be given the option and they should be allowed to make a fair decision. And as you can see, I don't think there's much evidence of any destroyed faces so far. Have you seen any?
No.
They just put comments up, but they don't put any evidence
No
of this.
pictures are put up, and that's like the first thing I would kind of look for is when somebody is saying something, then give me proof.
Yeah, I mean, you would have thought if we destroyed people's faces, they would be very happy to say, look, look what happened.
Even if they, I mean, even most of the time when people post those types of things, they might blur their eyes out, but they'll at least show where the damage
they
is.
can anonymize the photos because blurring the eyes out can anonymize the photos, but no one's really willing to share those with us.
No.
So I think it's a little bit unnecessary to ban or stop a very successful procedure that is evidence-based, just based on people's perceptions of their own image.
Yeah, I do think people need to be careful about what they say. I do think it's very unfair.
Scaring patients is not fair.
If it is that bad, people do need to post photos.
Yeah.
And show that proof, because that's the thing is, especially when people are going anonymous, you can't contact these people. You don't know who, you know, who it is. That they might be saying, oh, you know, this with my face and da da da. But you haven't seen the photos. You haven't seen them. You can't go. So I think that people need to be careful about what they say. And I think with this procedure, I think everybody should have the option. Everybody needs to do their own research. And when you go into something like this, go in wholeheartedly, be confident with your decisions, and be kind to yourself. And things take time. Healing takes time. And for me personally, it was all worth it.
Well, we're now 26 days after Taylor Liberator, and as you can see, your swelling isn't dramatic. And if there is any low-grade swelling left, the only way that's going to go now is down. So if, as these people say, you have to wait for swelling to go down for many months before you'll see this chubby cheek deformity, then you can see that that's nonsense, because swelling is going down, your cheeks are going to get narrower and narrower, not bigger. So if in 26 days your cheeks are looking the way they are, I don't anticipate they're just going to suddenly drop out of your face and then fall by the side of your jawline. I think things are only just going to get better from now on. So thank you so much for giving us a first-hand opinion on what's going on and helping us to save Taylor Liberator for treatment of people with severely tethered scars, Jackie. Thank you.
Yeah, of course. My pleasure.